The issue of community testing, we're using antigen testing now, so Department of Health working with the municipalities must increase that. When you find there are areas where there are more numbers coming, you need to concentrate there. Let's go there and do the test. Now the way we're doing it, the antigen test takes about 15 minutes. So within 30 minutes, someone will already have some results. And in that process, we link them to their IDs so that when you report the numbers of tests that have been done, we already include those that were actually out in the community testing area. And it helps so that you can pick up people early and refer them to hospital. And it sends the message strongly as well that this area we see it as a hotspot, and so people must be conscious that everyone needs to know whether they've got the infection or not, and it's a very important issue. So we're going to actually make sure that this gets strengthened with the Department of Health working with you as it will. I have mentioned already the issue of publishing hotspots. That testing will help us as well, because then you can actually always focus on those areas and make sure people understand that you are in this area. The level of infection is much higher here, and so we're focusing on it. And so I'd like that the department must give a lot of emphasis to that. The other reports that have been given are showing some of the things that we should know. The issue of comorbidities, we have to protect people who have got other underlying diseases. It's a big issue. Everywhere, this is where we're losing people. People have got other problems. Hypertension, diabetes are the main issues. It's still going to be a matter of research why HIV positive don't feature very high in this thing. I think it's a good relief to see that from where we sit. We still don't understand why. So it's an issue that we have noticed as well. Then the issue of contact tracing is key. The only way you break the cycle of infection is to make sure that those who have got infection are isolated, they are quarantined so that they can burn the virus out and then get better without contaminating the next person, and so on. There is this app that we have said needs to be downloaded, and I'll send the contact to Speaker Njadai and ask him to send for everyone here amongst the mayors, MMCs and everyone, because it does pick up when you are in a situation when more and more people have got this app. So when you get tested in the community out there, what happens? You get tested in the community out there, then it's linked to your ID and your cell phone. So the report of being positive goes into the database, and then your phone has got this app, and therefore this app will then search around in the area. People who have got the app using Bluetooth technology, it searches around, and then it spots others that have got the app, and it begins to whisper to them to say, listen, we are exposed. It means that phone knows that the owner is positive, and then it tells a few others to say, guys, we are exposed. It doesn't say who, it doesn't say where, it doesn't say what time. So when you sit with this app one day, now that app is like, it will show you green flag and everything is fine. Then one day it shows you orange or amber color, and when you look at it, it says on such and such a day you are exposed. Now then it says next steps, what do? Then it takes you through the steps of what you need to do because you're exposed, and somewhere along the line you also need to get yourself tested, and as soon as you get tested, the positive results will be linked to your phone, but because those it doesn't tell who is. So for example, if we sit here within a short distance of about 3 meters, or we greet each other, hey, how are you? and everything. Then you end up with the phones chatting to say you are now exposed. So a few days later, it gives you a report to say and it tells you of the date. You will then know where you would have been with people, and therefore you then follow the process to go and get yourself tested, and then does the same every time you get to that kind of situation. So it's going to be important that people who are patrons in restaurants, in taverns, in shebeens, in public places, they must actually insist that if you're going to come in here, you must download this thing so that we can pick up if you've been exposed whilst with us, and or if you are exposed and whilst with us, you will be able to share that. So we're going to be promoting that very strongly as well, to say as part of the additional armaments of dealing with this issue. So with that, I think the idea of discussing with various industries is important. Agriculture, to be able to say, let's work together to deal, particularly with the seasonal harvesting, how to reduce the contamination or the spread of the infection in such areas. It's important to be able to work with the various sectors like that. At the end of it, it's not our intention to actually close down the economy. Our intention is to reduce the spread of the infection and try and help people to be able to continue to earn a living and get themselves their income. And we don't want to sit and stop people doing what they wish to do, because this is festive season, but we also don't want to allow a situation where there's so much of negligence that people can actually go all out to infect others. You've just cancelled the one rage party around here. Actually, we had to issue a call over the weekend when we got, they did one rage party in KwaZulu-Natal, and a few days later, 92 youth had actually tested positive. Of that 92, 17 were already back in Gauteng, and the others were actually around KZN. You will certainly have consequences from that. And so we actually issued a call to say all the parents who know their kids were there should actually go for testing, and they must be tested, and when they get tested, then of course they need to be quarantined and all of that. But you can imagine it was fun for them, but one of those or some of those will have gotten infected, and when they get home, or to parents who never had anything to do with this thing, now because they've got diabetes and hypertension, they're going to succumb and actually might even lose their lives. They lose their lives because somebody went on a bash. It's not fair. So that's the message that we have to send, to say, we'll live long enough to be able to have another bash and another festivity when we no longer have the crisis. But just to be patient for one season to get out of this situation, I think it's an important message that we must send through. And so at this point, therefore, let me hold it and say that we will table all of this to the National Coronavirus Command Council, and your plan is spot on. Your plan is as we would have liked to see it, so continue with that good work. And Speaker, thank you very much for intervening to assist us with our program, because it may well have been within a very short notice, and I know that you had your own program, but you have been very kind to oblige us. And as we have this situation, we do want to say that the consultation is much proper the way that it's been done. So we really do appreciate that. Now I see Dr. Zungu is here. This use of mask, you have to study the forehead and the eyes. It's worse mama when they decide to pass a and then you end up end up with a very limited scope for facial recognition. So the acting head of department, Dr. Zumu, is here. Just raise your hand so everyone must see where all the complaints must be sent to. And there's a list of issues that have been raised on the health side that we will have to deal with you and Dr. Matiwa, and it doesn't get him out of the hook, but it just means both of you are on the hook now. But thank you very much for that. So at this point, let me say thank you and say that the President will announce everything, that because it's going to go through cabinet, and it's also going to go through provincial leadership, which is presidential coronavirus command it's presidential coordinating committee, which has got premiers and MECs. It's very, very important that that level of consultation must also happen. So it will all happen. At that point, we also now will be making recommendations to the President for areas which are not hotspots. Because clearly from what we can see now, we can either have a hotspot now, or you have areas where people are going to go to create a hotspot. So they are going to be creating hotspots, particularly the coastal provinces need to be very much alert on that, because that's where the movement of the people tends to be. But as I said now, there is already indications that KwaZulu-Natal, the numbers are increasing, and that increase is a matter of concern. And of course, we've discussed this with the province. We will be discussing with Gauteng as well, because their numbers are also picking up. At this point, their numbers are going up. Now, I can imagine that if we don't put any restrictions and encourage behavioral change, what we should actually be seeing at the beginning of January, second week of January, when people are back to their normal places of work, is going to be something that's going to be quite a challenge. And so we need to be proactive within the scope of not restraining people's normal enjoyment and festivities, which happens at this time. But at the same time, our message must be enjoy responsibly. You cannot enjoy yourself in a reckless manner that will result in more people getting infected and others losing their lives. That must be our message. Enjoy yourself, yes, but let's enjoy with restraint. We cannot enjoy ourselves in such a way that our enjoyment results in more people getting infected, getting admitted into hospital, and also even losing their lives. It cannot be right. And therefore, that's the message which we must make sure everybody has got. And so, thank you very much. At this point, we'll move on with our program. Thank you very much, Speaker Njadai, and all the mayors and other speakers and councillors and NMCs and MEC and officials. Thank you very much.
No, thank you very much.
All right, the Health Minister there, Dr. Zweli Mkhize.